If you have a mastectomy, you usually don't need radiation therapy. Now, there are exceptions to this, and the exceptions are a little technical. One of the exceptions is if you had a big cancer originally, called a T3 cancer, greater than 5 centimeters in size, that is typically an indication, even with a mastectomy, for radiation therapy. That's part of what's called the multimodality treatment of breast cancer. Another indication is if you have what's called angiolymphatic invasion in the breast tissue that came out with the mastectomy. What do we mean by that? Meaning when the pathologist looks at the breast, they can see cancer cells floating or directly invading into the little lymphatic channels or the little veins within the breast. That's typically another indication for radiation therapy after mastectomy. Another indication is having multiple lymph nodes involved in the axilla at the time we take the lymph nodes out. Typically, this is 4 or more lymph nodes are involved, or fewer than the 4, but the cancer is growing out through the walls of the lymph nodes. That's called extranodal extension. So those are indications for radiation therapy after a mastectomy. Now, if you're a patient with stage 1 breast cancer and you had the choice between lumpectomy plus radiation therapy, which is the typical combination, versus mastectomy, the standard stage 1 breast cancer, T1A, T1B, T1C, where the lymph nodes are negative, and you've chosen now to have a mastectomy, there are very, very few indications in that setting that you would in fact need radiation therapy. The one that comes to mind is that even being lymph node negative, smaller cancer, there's a positive margin. In other words, the cancer was growing into, let's say, the underlying muscle here, and even being stage 1, because there was a positive margin, in that set of circumstances, you might need radiation therapy as a way of local regional control. But the typical standard patient with stage 1 or early stage 2 sort of breast cancer that doesn't have any of the things that I've just talked about, but you have chosen to have a mastectomy with or without reconstruction, typically you will not need radiation therapy. Hi, I'm Dr. Jay Harness, and I want to share with you important information that I believe that every newly diagnosed patient with breast cancer needs to know.
I'm a breast cancer survivor.
I am a breast cancer survivor.
I am a breast cancer survivor.
And I want every woman to know
about personalized breast cancer treatment
and the genomic test.
A test that helps guide a woman and her doctor
to the best treatment options for her.
Pass it on.